What happens behind the scenes in the ER? Part three. If you made it this far, we're on to the discharge portion. If you haven't followed the first two, where you check in the waiting room and you get into a room, make sure you check those out. All right, now we're at discharge. So, usually at this point, that means some sort of disposition has been made. And whether you're okay enough to go home, you're sick enough to stay in hospital, or you need to go to another facility, that decision usually is made by the ER provider who's taking care of you. And at this point, the nurse is going to try and get your IV out, get you any last medications. Sometimes, too, we need to ambulate you, make sure you're okay walking, or we need to make sure your oxygen level is okay getting you up out of bed. There's a lot of things that come into play at the very end that sometimes can change a disposition as well. Sometimes we think somebody's ready to go, they fell, they don't have a hip fracture, everything's okay, but they can't walk on their own. That changes that disposition very quickly from a discharge to an admission to help that person further with some physical therapy or pain control. So there's a lot of things that can change at the very last minute, even though laying in bed, we thought we had it all figured out. So if you're not going to go home and you're going to get admitted, now a whole other process starts where we have to assign you a bed, get you the proper level of care, and make sure that the staff is ready to receive you. Sometimes this process can take quite a long time, and with how busy ERs have been recently, these wait times can sometimes be quite a while. So just because you're sitting in the ER doesn't mean the admission staff is taking care of you and orders are being executed. Usually, a hospital doctor, an internal medicine doctor, will come down and start asking you questions and getting orders placed so that you can have the most expedited, safe, and healthy admission. And lastly, same kind of thing happens in transfer. If we have to transfer you to another facility for insurance purposes or for a higher level of care or more specialized care, we have to wait for the accepting facility to have a bed ready. We have to set up ambulance transport if needed. We have to hand off to the nurse that's receiving you. There's a lot of things that happen in that instance as well. So make sure you're being patient with that process because, again, we're trying to take care of this in the most safe and efficient manner to get you the right care. All right. Thanks for watching. We're moving on to part four next. Make sure you follow along for that, where we cover what happens after you leave the hospital.